Hello, everyone. A very good afternoon. Thank you for joining today's FE Live. Today, I would like to share with you a very interesting topic on double eyelid and eye bag removal surgery. I'm Dr. Darren Khoo. I'm a consultant plastic, reconstructive, and aesthetic surgeon in Island Hospital. I have a fellowship training uh, to learn from the best from Korea, Taiwan. I'm actually more than 16 years in this aesthetic field, and I have a specialty and focus in aesthetic surgery. Now, until now, I have more than 4,000 aesthetic eyelid surgery, double eyelid lift, eye bag removal. There are various reasons someone see a blind surgeon to enhance themselves. Uh, the benefit will include the purpose or the reason would be to improve self-image. Or with the improved self-image, we can improve confidence. You also can have improved physical health, enhance mental health, and with all these benefits, actually, when we look good, feel good, we have a lot more opportunities, include better job opportunities, higher salaries, and easy to get into a relationship. This is the list of the benefits of plastic surgery. Since our topic today is on eyelids, actually the benefit of eyelid surgery is, among others, to improve the vision because we remove away any blockage in the visual field. Um, what's the ideal eyes? Ideal eyes, we should have a very nice, beautiful double eyelid, a bigger eyes, and the eyelids be smooth without wrinkles. And eyes are the windows to the soul, and it's a key attractive features to the face and important for daily interactions. Thus, eyes should be the first part on the face to be corrected or to be improved. And this aesthetic eyelid surgery had a dramatic impact and on how we feel and how we look. How common is natural double eyelid? I mean, only estimated only 50% of East Asian population had double eyelid crease. I mean, only half of the East Asian are born with natural double eyelid. Study has shown that for Malaysian, around 70%. I mean, out of 10, 3 doesn't have a natural one. So if you don't have a natural one, with bit of help, you can create one. Slide information on the structures of the eyelids. This is to show the eyelids in a Caucasian lady, for example. We have a skin, we have a muscle, we have a fat pad here. And this is the muscle, we call that levator palpebral muscle is a muscle to open up our eyelid. And important to note that in Caucasian eyelid, there's a connection between this muscle and to the skin. Therefore, when this muscle is pulling up, the fold or the double eyelid crease will be formed. Whereas in Oriental, those without a double eyelid, the reason because there's no connection between this muscle and the whole eye skin. That's why we don't have double eyelid. And second reason because a lot of fat, all the fat actually at the lower position, preventing from the eyelid crease to be formed. So who's to consider double eyelid surgery? Of course, if you don't have one, you're not born with one, so they don't have, or you have asymmetrical eyelid crease. One side have, and also have, for example, in this example, uh, uh, a low or lax low eyelid on one side and absent on the other side. And if eyelid droopy also, you may consider double eyelid surgery also. I'm sure a lot of young ladies knows you can use a eyelid tapes to form a double eyelid. Yes, you can do so. This is one of the natural ways. Just use a tape, but you have to do it every day. But the time when come, you didn't feel tired of doing every day. you can consider double eyelid surgery. So how to do it? Actually quite simple. You can actually buried suture technique or just incision technique. Buried suture, I mean there's no incision being made. Just we create a connection between the muscle, the muscle I mentioned to you, the levator muscle, and the O-line skin. With this connection, is a stitch we can easily create a double eyelid. So just small minimal entry points on the upper eyelid is required to form the double eyelid. Usually, I perform 3 pairs. So in other words, actually, if you perform only one pair, one stitch, you can form a double eyelid. But to ensure the double eyelid is permanent, long-lasting, usually 3 pairs of stitches are being placed. Therefore, this double eyelid is meant for long-term and permanent. And important because it's a only small tiny entry point with stitches. There's almost minimal to no scar after healing. And how's the process of the double eyelid surgery? You see, it's quite simple surgery, only about 30 to 40 minutes. Uh, you can do under local anesthesia. However, to ensure the best comfort, usually we do under sleep sedation. I mean, during the whole process, you're put it on sleep, you're comfortable. And this is quite a short procedure. Actually, no, we don't need admitted hospital. It's just an outpatient procedures. And usually the entry points, the small tiny entry points, will not be hardly visible after a few days. Since the suture is buried, so no suture removal is required. We are expected to have some degree of swelling, bruises, or initial, most people in first week, some may up to second weeks. So by end of second weeks, usually by 80-90% swelling subsided, and you can return to your normal activity. Or even actually, if you're able to go out or doing some office work, you actually can return to work as early as after 3 days. But most often, you're advised to wear some sunglasses so that people won't see your swelling and bruises. This is our real results. This is before and after. You see the double eyelid crease is being formed naturally. An example. So you can see with the double eyelid, uh, apart from double eyelid look good, the eyes also look bigger. The second ways of doing create a double eyelid is where incision is required. We call that incision technique, where incision is placed over follow your natural double eyelid lines, and this technique is suitable for those with thicker eyelid skin, and also those with a lot of fat excess or fat puffiness. And if there's a lot of lateral sagging of the skin also, we may choose up to incision technique. It's a result. You see the before the surgery, you see the eye look droopy, even covering part of the cornea. So this an example. See without double eyelid, the this one the double eyelid, okay, this example where I say incision technique is required because the eyelid is puffy, a lot of fat. So in incision technique, the fat will remove completely as required, and the eyelid crease will form naturally. Some even have more pollen apart from this one, for example, we have it may have a bit of double eyelid, but it's asymmetrical. Sometimes have more lines, we call triple eyelids, and at the same time the upper eyelid is sunken. In this incision technique, may be more suitable to have the best result. Okay, I'll touch a bit on the What is ptosis? Ptosis is a term to suggest there's droopiness of the upper eyelids. Droopiness not because of the eyelid skin sagging, but because the upper eyelid is not able to open fully due to the weakness of the eyelid levator muscle. That muscle I mentioned to you, this muscle has some weakness, therefore it could not open the eye fully. So the eye look half closed, looks sleepy and tired. And this could happen since birth due to nerve injury, muscle injury, or even the aging process. Because the upper eyelid is not able to open fully, we block part of the and our eyes, so our visual field will be blocked. In if someone have ptosis, we do ptosis correction surgery. A lot of similarity like double eyelid surgery, insertion technique, but additionally is we need to have a muscle tightening. In other words, we create a double eyelid during surgery. We need to tighten the muscle, the levator muscle, so that the strength of the muscle being increased, so that the eyelid could be opened fully to create a big and more attractive eyes. See, imagine we have this kind of eyes. It might look sleepy, tired. Huh? So with the eyelid, the ptosis correction and also double eyelid formation, you see the eye look nice and natural. And this could happen in, for example, just now is both sides. The sleepiness, ptosis could happen in both eyes, or it could happen in one side, and it can happen in male and female. See this one side on the right eyes, and absence of double eyelid, so we create a double eyelid and also do a ptosis correction over the right eyes. And not all eyelid surgeries is meant for aesthetic or cosmetic reasons. For example, this 84-year-old lady have a degenerative ptosis because of aging. So because of the eye not able to open fully, actually her vision is normal. The vision normal, she can look normal, but because the eyelid cannot open fully, she had to lift her eye to see. So this caused a lot of problem for her. With this eye, she had to need the help of family to guide her go around go to move around. So when she come to me, she asked for help to make this to correct this condition. So we do a ptosis corrective surgery where the upper eyelid muscle being strengthened so that she can open her eye. 3 months after she see me, she's so happy. She can move around. She can independently moving around and have a better quality of life, even at an old age. Okay, right. Facial aging. The aging process, especially on the face, can start as early as age of 25. And the first sign of aging usually happen around the eyes. So what are the signs of aging on the upper eyelids? There will decrease in skin elasticity, the skin will excess, the sagging, especially on the side way, or we call it lateral part, if the hooding of a sagginess of the upper eyelid skin. Some even have the fat pad protrusion, the fat pad accept, causing the fullness and of the fat pad. Around they have some fine wrinkles, and this might have, especially for example, this one obstruct the visual field. Whereas in low eyelid, most of you know the sign of aging will be a formation of eye bags, where they have fat bulging and skin excess because of laxity lower eyelid skin. And most people might not. Okay, one point I always highlight to those patients come to our consultation. This part is called eye bag. It's bulging, but adjacent to that, actually on the cheek, between the junction between lower eyelid and the cheek, there's a groove. We call it tear trough. Tear trough in this region is a loss of volume. let's say become sunken. Someone with a tear trough, that means sunken area here, they make the eye bag even more prominent. So when we do correct the eye bag, we should focus on the tear trough. So with this eye bag, we might look tired, older, and unattractive. So how to correct the aging signs around the eyes? We my ways of doing, I have four important steps ways of correcting the aging sign of the eyelids. For upper eyelid, we do upper eyelid lift to remove the excess eyelid skin and fat. Of course, eye bag, we do eye bag removal, remove again the excess fat and skin. Whereas in tear trough, as I mentioned to you, you need to fill up the hollowness or loss of volume with we can fill up with, of course, you can fill up with filler, but the best option still using your own fat tissues. Where a small amount of fat is being borrowed from the thigh or abdomen. After process, we do an injection for this sunken area or the tear trough. It's a quite minor procedures, but you can get a much more lasting and natural results. And any wrinkles or pigmentation problem around the eyes can improve with laser. So the laser is used to improve the color, texture, the tone of the eyelid areas. Upper eyelid lift. Upper eyelid is a trick for any sagging of the upper eyelid and remove any excess skin on the upper eyelid. So actually the method actually quite similar to the double eyelid surgery that I mentioned earlier on, where the incision is made over the natural double eyelid, but those skin excess over the upper eyelid is being removed. And when it go inside, any fat that protruding, excess also removed. After that, the stitches is being placed on the double eyelid, your own original double line, so that your eye will look like your older self, maybe 10, 20 years earlier. It's rather a simple procedure also. Will take around 30-40 minutes. We can do the same thing under sleep sedation as an outpatient procedures. Stitches usually will be removed after 7 to 9 days. And you're expecting again some degree of swelling bruises was in our initial 1-2 weeks. And after that, the swelling, the bruises will slowly gradually subside, and your eye will look natural and more younger. Example, this patient, you see that these are markings that the fat that I would like to remove. Usually got 2 to 3 fat pad that I remove from the upper eyelid, and this is the excess skin, the saggy skin excess due to the process aging. This part of the skin removed, so we form a very nice, more useful double eyelid. See again another view. This is the excess skin, and that will continue drooping down. If you don't do anything, when the eyelid skin is saggy, of course, with time, this one will keep droopy and more saggy. So after remove, your eye will look like when your younger self. An example, see, we can you see this is a fat protruding, the saggy lateral eyelid skin, and also the double eyelid original also been not been covered or droopy. So we create a natural double eyelid through upper eyelid lift. Side view. These are around 60 plus years old lady. Then see you had a upper eyelid sagginess here, covering part of the eyes, and also had an eye bag. So upper eyelid lift and eye bag removal is being performed at the same time. Eyelid surgery or aesthetic eyelid surgery is not confined to ladies. Actually, men will also benefit from this surgery. Is this 50-year-old gentleman? have a see the upper eyelid sagginess, actually covering part of the upper eyelid, part of the eyeball. In fact, cover half of it. Then lower eyelid had eye bag and tear trough. So this is a photo we take after 3 months. You can see she improved himself a lot. Her visual field will not be blocked. Uh, sorry, his eye look more energetic. Hmm. Eye bag removal surgery. Okay, so people may always ask, what is eye bag? Eye bag, as the name suggests, is a bagginess over the lower eyelid. There are two components in it. One is because of the excess fat. The fat used to be, actually the eye bag, the fat used to be just like a cushion below the eyeball. With time, the fat actually herniate or protruding out, and same time, because eyelid skin is being lax because of reduced elasticity, it being bulging out. So two components, one is the fat excess, second component is skin laxity. These two components will cause the eye bag. You see on this one, this eye bag, look at the bag under the eyes. So in eye bag removal, for medical term, lower blepharoplasty is to correct these two components. One is the fat component, second is the remove the excess skin. So in this surgery, the actually incision is placed just on your eyeliner lines, and the fat removed, the excess skin is removed, and stitched over the eyeliner lines. So you can see incision is placed just your eyeliner line on the lines below the eyelash. So the line, the incision will be well hidden. Again, this is quite a not a simple procedure to me. Maybe like 30-40 minutes. Again, under local anesthesia with sleep sedation as outpatient. Stitches need to take out about 1 week later. Usually, eye bag have those underwent eye bag surgery, swelling will less compared to upper eyelid. In some patients, they after 2 3 weeks, they might look good. Some might a bit long, maybe long also not too long. Usually, most of my patients by 1 month they really look good. Examples is mild degree of eye bag is actually here. Some fat bulging, some fine wrinkle, skin laxity, but this eye bag look more prominent because present of the tear trough. So to have this kind of result, the smooth transition between the cheek and lower eyelid, we need to correct the tear trough and do eye bag surgery at the same time. There's an example. We eye bag surgery with correction of the tear trough with fat graft, and also actually the upper eyelid is being treated with some so using own fat tissue, also fat graft injection. So we correct the upper eyelid and lower eyelid at the same time. This is the result. This is more severe degree of eye bag. So you see after surgery, we smooth lower eyelid and cheek junction. So that's my sharing for today. Okay, if you have any question, you are welcome to ask. Maybe before that I try to answer some of the common questions being asked to me during consultation. Some may present to me asking the eye circles. The eye circles, actually, we look carefully, the eye bag, the eye circle is contributed by multiple factors. Uh, One is because of the pigmentation, the pigment being deposit on the lower eyelid. It can be inheritance. Uh, and if you look carefully, actually the eye circle actually contributed by the contour bone, meaning there's an eye bag and also there's a tear trough. So in eye bag surgery with fat graft injection, we actually can treat the eye circle at the same time. Oh, actually, men also don't have double eyelid. They will look more attractive with double eyelid. I'm sorry, Jolene Tan was asking statistic about men. Um, yeah, actually the statistic more or less the same like the female. Um, and nowadays the demand for double eyelid surgery is increasing among male patient as well. I mean, men also want to look good with a double eyelid. Uh, Also, maybe the next one will be someone that question asking what's the age, what's the right age to perform double eyelid surgery or aesthetic surgery as a whole. Usually, my advice would be 18 years old and above. If for double eyelid, the best is after high school, before go to college, uh, so that is a transition between high school and university. That's the best timing, the earliest, so that wherever the patient is make decision from themselves, not from the parents. Uh, That's Ms. Tan asking what's the cost or risk of eye bag surgery. Maybe talk about the risk. Okay. The after eye bag surgery, you're expecting. I mean, you are expect to have some degree of swelling, bruises, and also this swelling bruises is more significant on the 1 2 weeks. Most people by third fourth week will look good. Bruises swelling settle down, but some people might experience some teary eyes, especially on the initial days, initial one week 2 weeks, teary bit teary be a redness of eyes. uh, and lower eyelid need to perform carefully so that there's no eversion of lower eyelid. So the risk of eversion lower eyelid is higher in older age group. That's why this surgery, although looks simple, need to be performed by expert hands to reduce the any complications or risk. Lah. Yes, another common question often posed to me is, can I remove eye bag without incision? Yes, you can. The eye bag actually, okay, just now I mentioned two components of eye bag. One is the fat excess. Second is the skin laxity. For those without, that's the more like the eye bag is due to fat excess. That means the fat bulging. We just need to remove the fat. Then we no need to remove any skin. In this kind of condition, usually, in other words, those eye bag in a younger age group can be performed without incision, where the fat is removed from internally without any external incision. In other words, 100% no scar at all. And okay, um, if you want, okay, okay, maybe in conclusion, um, I would say eyelid surgery is a simple surgery, or but although look simple, but it should be performed by the expert. So if you would like to have a eyelid surgery, please choose qualified and certified plastic surgeons, and you can actually search under the keyword national specialist register plastic surgery. You can get a list of qualified and certified plastic surgeons in Malaysia. The patient asking, Lily asking, uh, usually how soon eye bag can grow after eye bag surgery. Okay, eye bag surgery, okay, usually you have performed eye bag surgery, the fat removed, the skin removed. If for that the skin to be become because aging process, okay, if the this aging process, the skin might lax to some extent in future, maybe years later. If you also lack of sleep, always tired, the fat bulging might recur, but the recurrence or the relapse is varies. Some have most often after the first eye bag surgery, the result might last many years, 5 years, 10 years, even more. Unless your lifestyle is those are busy, tired, always tired, sleep late, have sleep problem, your eye bag might come back after several years. In other words, after eye bag surgery, some maintenance with some your lifestyle changes, some eye cream is best to maintain results. Okay, I think we almost to the end of sessions, unless I have more questions. So, so again, thank you for joining the session today.